Dr. Terry Wahls, we're so excited that you're here. I know your journey to healing is empowering thousands and thousands of people, but I'd be curious to maybe take a step back and start talking about your journey with autoimmune. What did you start to feel like when you were a young physician, and maybe what were some of the symptoms that you were experiencing at the time?
Well, it depends on how far do we want to go back. If we go back to the first neurologic symptom, that's clearly neurologic. It was electrical face pains that would begin at my temple, come down across my jaw. And at first, it was just twinges of discomfort. That would last a day or two. And then they became more intense than electrical. And so I had 20 years of worsening face pain. But this all began in 1980 during medical school. And then I had an episode of dim vision while rollerblading on a really hot August day in Wisconsin. And I basically lost vision in my left eye. So that was quite startling. Big workup, no clear explanation other than you must have some sort of autonomic dysfunction of the retinal blood flow. Quit training so hard. So stop your racing. And I also observed that if I got hot, I couldn't see as well. So I also quit taking saunas and going into hot tubs. And I could still work out, but I couldn't race anymore. If I raced, then I couldn't see out of my left eye. I saw ophthalmology, saw neurology, and they did not link the trigeminal neuralgia and the transient dim vision. I was having dinner with a friend who was a neurologist. I said, the vision in my left eye and my right eye, the color is a little bit different. She said, you'll have MS someday. And the next morning, my father died unexpectedly. So that comment, of course, was completely forgotten until 13 years later, when I developed weakness in my left leg, when I then, again, that was transient after having walked several miles. So I went to see the neurologist and began the workup. And while I'm going through the workup, I'm thinking about the fact I've had 20 years of progressively worsening electrical face pain. So I know, okay, this is a progressive disorder. I don't want to become disabled. I don't want to be a burden to my family. So I'd rather have a rapidly fatal diagnosis like ALS than, a slow lingering problem.
So at that point, can you kind of walk us through essentially once you received your diagnosis, what was the treatment plan at that time? And then at what point did you start to think maybe there's another way to go about this?
Yeah. So remember, I'm a internal medicine physician at a teaching institution, here at the University of Iowa. And so I do what probably many physicians do. As soon as you're diagnosed, you start going back and reading the literature, learning more. I'm reading PubMed. And I'm seeing that this is a progressive disease and that job loss occurs, early nursing home care occurs, and I'm getting more and more agitated by what I'm reading because it's, so grim. And so my partner, Jackie, says, honey, you got to stop reading. It's just getting you upset. So let's go figure out who the best MS center is in the country, and we'll go there and let them take care of you. So I went, and found the best physician. I had a very thoughtful evaluation. And we went, and at that time, it was the ABC drugs. So either beta-seron or Copaxone, a decoy protein. The problem with the beta-serons is they make depression worse. And since I've been an adolescent, I know that I've had struggles with depression. I'm like, okay, can't take the interferons. I'm not going to make depression worse. That will be bad. So I did the Copaxone. I'm 45 years old at diagnosis. I have been athletic that whole time, working out very carefully that whole time. I've been following a low-fat vegetarian diet since medical school. Then I did some more reading. I discovered the swank diet, okay, so that sort of fit in with what I was doing. I adapted that. I was doing the Copaxone injections, and that really was the only treatment that was available at that time. The swank diet, the neurologist didn't endorse that, but that was out there in the lay press world. Then 2 years into this, my neurologist mentioned the work of Ashton Embry and a direct MS charity, because his son had MS and had remarkably improved by adapting a paleo diet. So I went back to reading Lauren Cordain's work, all of the papers that he cited. And after a bunch of prayer and meditation, I went back to eating meat. That was a big deal. But I continued to decline for the next year. I'm in a tilt recline wheelchair. My face pain is continuing to get worse. Fortunately, I'm mentally clear. That's when I ask myself the question, am I really doing all that I can? Because I could be going, and like I already know how bad it's going to be. Terrible. I'm already in a tilt recline wheelchair, only 3 years into my diagnosis. So I might as well go back to reading the basic science, because now I'm not agitated about things being worse, because I know it's terrible. I mean, it's already really pretty terrible. So now the question is, what could I be doing? And so at first I'm looking for drug studies, looking for repurposed drugs. And then I finally realized, why don't I look for supplements, read supplement studies? And I decide that mitochondrial dysfunction is what drives disability in the setting of MS, in the setting of Parkinson's and Alzheimer's and all these diseases with shrinking brains and shrinking spinal cords. And so I devised a supplement cocktail for my mitochondria. And I think, I did that about 6 months, and then thought, it hasn't done much. So I'm just going to quit, because I'm just wasting my money. And 36 hours later, I just really am even more exhausted. Too exhausted to go to work. I can't. The third day, I'm feeling worse still. And then Jackie comes in and says, honey, why don't you try taking your supplements again? So I went ahead and took them. And the next morning, I woke up and said, I was sort of back to normal. So I'm still fatigued, but I'm feeling way better than I'd felt, the day before. So I think, wow, that's really interesting. So I said, Jackie, let's do the same thing in 2 weeks. I'll stop the supplements and we'll just see what happens. And again, at 36 hours, I felt terrible. At 72 hours, I felt worse still. And then I took my supplements and I could function again. So my conclusion is, okay, they aren't making me better, or maybe they're managing the fatigue a little bit, and they're probably slowing my decline. And I am so excited. Like, I'm figuring stuff out. I'm figuring stuff out that my neurologist doesn't know, that my primary care doctor doesn't know. And reading that basic science is a very smart thing to be doing. So I'm keeping it up.
Yeah, I would love for you to share a little bit about what was in that mitochondrial cocktail. Obviously, everybody's different and unique, but
everyone's different and unique. And I want to comment that, I'm not a PhD. I'm not a neurologist. Reading that basic science was really hard work. And I'd have to go over the papers again and again. And at that time, I started with creatine, carnitine, lipoic acid, B vitamins, and CoQ. And it's like that combination certainly supported my mitochondria. Then over time, I would gradually add a few more things. So I began to realize that magnesium and zinc are critical and are often low, so I added those as well. I would eventually realize that iodine can also be super helpful and help you clear these toxins out. So I'd add iodine in the form of seaweed. So I started having a lot more seaweed. And when I was cooking with seaweed, my family said, like, "Oh my God, Mom, these are the best broths. This is the best soup. It was just amazing." And of course, now I realize what that seaweed was doing was bringing the trace minerals that we were deficient in. And that's why we're like, oh my God, this is just incredible. Broths, soups, stews, casseroles, whatever. I had the seaweed blend in it.
Yeah, so speaking about food, I know that at a certain point in your journey, you said, okay, I'm taking all these supplements, but what about like the original source of these nutrients? And then you kind of pivoted to food.
And I really have to laugh at myself. Like, how long did it take me to figure this out? My decline is continuing. And I'm beginning to have some brain fog. My chief of staff calls me into his office to say, I'm assigning you to the traumatic brain injury clinic. There won't be a resident. You'll be part of a team, and you'll be doing the primary care exam. And he goes on to describe this. I go home, tell Jack, and she goes, there's no way you can do that job physically. I'm like, well, in January, I'll go to that clinic, and either I can do it or I can't, and then I have to finally apply for medical disability. So that was a very tough message. I was certainly distressed. And, it's like God was whispering in John's ear to tell me, to assign me to that. Because 2 weeks later, I discover a study using electrical stimulation of muscles in people who are paralyzed, never going to walk again. And gets me curious, would that be helpful for me? So I convinced my physical therapist to give me a test session. It hurts really quite bad, actually. But when it's over, I feel great. It has this amazing impact on my mood acutely. So we add electrical stimulation to my physical therapy. And after 2 weeks, he gets me a homegoing device, and I start doing electrical stimulation. When I do my little tiny, itty-bitty, tiny mat exercises, 10 minutes once a day. Because if I do more, I can't function and go to work. And as I said, I've been taking these supplements. I had discovered the Institute for Functional Medicine at about the same time that I was starting the electrical stimulation of muscles. And they had a course on neuroprotection, a functional medicine approach. I ordered it, a big notebook of cases, and then a series of PowerPoints with synchronized audios. So I'm listening to that, taking notes. I have a much longer list of supplements, which happy to add. Not a lot's happening other than the fact my electrical stimulation hurts a lot, but I feel mentally just so great afterwards. Then, I don't know, I think it was probably October. I was like, I wonder if I would figure out where these nutrients are in the food. Maybe I should redesign my paleo diet to stress these foods. So that's a few more months of research to get that sorted out. And I now have a list of foods that I know I should be stressing more. And I start this new way of eating December 26, 2007. At that point, I'm so weak, and I've been so weak I cannot sit up in a regular chair. I'm in a zero gravity chair with my knees higher than my nose, and I have one of those at work, staffing residents, another one at home for how I take my meals and interact with my family. I can take a couple steps using 2 walking sticks. I have this, really intense trigeminal neuralgia, electrical face pain, and I'm having issues with brain fog. I start this new way of eating. January comes. I go off to the clinic. The first 2 weeks, I just watch my new partners do the exams and, take their notes. And third week of January, I need to start seeing patients. And so Monday, I go and I see my patients, write the notes. And I come home that night, tell Jack, well, Monday went okay. And by the way, could I try sitting in a regular chair for supper? So we swap out my zero gravity chair. We have a regular chair. And I sit up at the table and eat with my family. First time in years. That's a big deal. I mean, that's a big landmark. When I go back to see my physical therapist, he says, Terry, you're definitely stronger. Let's have you start doing 10 minutes twice a day. And so gradually we increase. It's 10 minutes twice a day, then 15 twice a day, then 20 twice a day, and then 30 minutes twice a day. And then, by the end of that first week, I tell Jackie, I think I can do this. And my physical therapist, he's increasing my exercises. And then I start walking at the hospital with 2 walking sticks, stunning my colleagues. And they all think I must be on one of those new biologic drugs. And I say, no, I'm not. And I whip out my eStim device. I'm using this. I've changed my diet. And then next thing you know, I'm walking around with 1 walking stick. And then, in April, I'm walking around no walking sticks. And I tell Jackie, I really would like to try riding my bike, which I've not done probably in 6 years. She goes, well, honey, if things keep going well, maybe in the fall we can do that. A couple weeks later, on Mother's Day, I really want to try riding my bike. So we have a emergency family meeting, and my kids don't want me to ride. They don't want to risk my falling and getting hurt. But Jack says we can try. So we all get in position. She tells my 6'5", 16-year-old boy, Zach, you run alongside on the left. My 13-year-old daughter, Zebby, you run alongside on the right, and she'll follow. We get into position. She gives the all clear, and I push off. And I bike around the block, and that big 16-year-old boy, he's crying. Zebby's crying. Jackie's crying. I'm crying. If I still close my eyes and relive that moment, I still cry, because that is when I understood that the current understanding of progressive multiple sclerosis is incomplete, and like how much recovery might be possible. And so I biked a little bit more every day. And in October, Jackie signed us up for the Courage Ride, 18.5 miles. At that point, the furthest I'd gone was 8 miles. So this was a huge leap, but I did it. And once again, we're all crying. My kids are crying. Jackie's crying. I'm crying. And that really fundamentally changes how I think about disease and health. It changes the way I practice medicine, and it changes the focus of my clinical research.
My gosh, I'm getting emotional just hearing your story, Dr. Terry Wahls. And I've heard it before. It's still so incredible and touching. And it's amazing, because was it at that point where you were or when did you stop taking any disease modifying drugs?
Well, I was sort of an imp here. So, I'm walking around. I don't need my total recline wheelchair. I called my neurologist. I think it was probably in March. I called them and said, there's been a change. And so they want to see me that day. I said, well, no, Friday's better. So I go, I have the appointment. I'm going to see him on Friday. I'm in the waiting room, and I see the nurse coming out, looking around, and I realize she doesn't recognize me. So I stand up, I'm waving my arms like, hey, Cindy, over here, it's Dr. Wahls. She was like, oh my God, what happened? So I see my neurologist. I talk with him about what I've done, how I've responded, and that I really would like to try going off the disease-modifying treatments. And so, he gets a follow-up MRI. There are no active lesions. Everything that we had is old stuff. And clearly I'm, dramatically better. He says, you're old enough that, yes, I'm not sure these drugs are helping you anyway. You're just getting toxic effects. So I was on Cellcept. He cut it by half for a week, then cut it by another half for the next week, and then it was off. And so I continue to see my neurologist. I continue to be off the EMTs, and that's since 2008. And my neurologist continues to be improved, or to be impressed at. Even though I'm getting older, I'm now 68, I'm doing remarkably well. I can jog now. I have remarkable mental acuity, resilience. Fatigue is not an issue. Strength and balance continue to be good. And, my neurologist was part of our clinical trials. He's since retired. So now we have new neurologists that are part of our clinical trials.
You're mentioning these clinical trials. Since you went through your experience, you've helped so many people who are struggling with autoimmune conditions and help them think of a different way to approach their diseases. Can you talk about, maybe there's so many different ones out there, but they're the biggest ones of our time. What are some of the things that are leading to this uptick in autoimmune disease?
So, I think we can talk about the prodrome. There's a prodrome of symptoms that, if you have these, we know you're at significant risk for MS, inflammatory bowel disease, lupus, rheumatoid arthritis, psoriasis. In these prodromes are anxiety, depression, skin issues, belly pain, pelvic pain, infertility, migraine, headaches. Well, I had many of those. I should also throw in asthma, exercise-induced asthma. And so that indicates that your immune system is overly active. There's too much inflammation. There's probably excess oxidative stress. There's probably microbiome component in there as well. And if you're in that prodrome and we address all those environmental factors, we can probably quiet the prodrome and you never have to get the autoimmune issue. Unfortunately, our medical teams are not trained to think that way. So you have 5 to 10 years of prodrome trouble. Then there's finally enough damage that you have either inflammatory bowel disease, perhaps rheumatoid arthritis, multiple sclerosis, and you're down that part of your illness. And unfortunately, if we don't help you address the root causes, every 5 to 10 years, you'll get another autoimmune disease. And so we're beginning to have, when I go to the MS meetings, there's more conversation about the prodrome, more conversation about the environmental factors. They are beginning to acknowledge that leaky gut is a thing. They're beginning to acknowledge that the comorbid problems are a thing. We need to deal with them. And they're beginning to talk about diet and nutrition. The other thing that's sort of fun is that when I come to these meetings, more folks are whipping out their phone and saying, Dr. Wahls, could I get a photograph with you? My patients would so like that. And I'm like, yeah, oh, sure, we'll stop.
Amazing. It's so interesting because I remember listening to another interview, and when you had transformed your own health, some people thought they misdiagnosed you because they didn't believe it, right?
Oh, absolutely. So early on, I was condemned. My message was condemned. I was told that I was a fraud. They were told that clearly you could not have had secondary progressive MS because people don't recover from that. Now, fortunately, I'd seen many neurologists, so there was a lot of blame to go around there. And fortunately, my chair of medicine had called me into his office and said, Terry, this is so remarkable. What I want you to do is to repeat, write up your protocol as precisely as you can. And then we're going to have you do a clinical trial, single arm, seeing if other people can implement what you did. And do we hurt anyone? Is it safe? And what's the effect size? So we did that. First a study of 10, then a study of 20 folks with primary, secondary multiple sclerosis. They implemented the same, complicated protocol that I did. We had remarkable reduction in fatigue, remarkable improvement in quality of life, remarkable improvement in mood, and half of those folks had clinically significant improvement in motor function, better hand function, and or better walking function, which is extraordinary because you expect a 10 to 20% worsening of motor, all of these measures each year. So the fact that they improved is really quite remarkable. Unfortunately, I could not get funding to repeat that study in a controlled fashion. So then we started studying diet and had several very, very successful dietary studies. And we've got a big study going on now comparing a keto diet, modified paleo diet, usual diet. We'll follow folks for 2 years, and we'll have about 160 people in the study. So it will be quite exciting.
That's so exciting. I'm wondering, why do you think it is? And obviously it's not worth it really to reflect back on like some of the criticism that you got, because in my mind, it's like, what is the harm in changing somebody's diet and lifestyle? Like, why was there so much backlash there?
So change doesn't happen easily. What we all have our understanding of the world. And I was causing them to have to make a new understanding of the world. You can think of the Semmelweis and how he was ridiculed by saying that we should wash our hands between patients. And he was condemned. Barry Marshall, who said that bacteria cause stomach ulcers, he was condemned, crazy. He had a very difficult time getting his first papers published. I would posit to all of you that you have and I have a current understanding of the world. And so my understanding, for example, my family members, I hold them in very high regards. It would take an extraordinary amount of evidence to convince me that my family member was actually a spy for the KGB or doing drugs, some other crazy stuff. You just wouldn't easily give up your understanding of the world. For my neurology colleagues, they had an understanding that you take DMTs and there's nothing else that you can do about it. It would take an overwhelming amount of evidence for them to gradually realize, well, actually, maybe there's something that we could be doing about it. It's a 30-year journey now. I'm 15 years into that journey. We have published 70 papers into PubMed, and we have thousands of citations of our papers. So we are slowly being recognized that, yep, diet matters. And that we can have a debate, is it the paleo diet, the Mediterranean diet, the keto diet, intermittent fasting? They've all been shown to be helpful. In the network meta-analysis conducted by Dr. Snutzler, the paleo diet was the most effective for fatigue, the most effective for quality of life. And there are other diets that are helpful, but in a comparison, so far, the paleo diet is the best. However, we are making progress. There are more neurologists saying, by all means, take the DMTs, but yes, you should also work at improving your diet, and that you should exercise. And these environmental factors are important. It's not yet the standard of care. I would think in the next 15 years, it will become the standard of care.
Yeah, and speaking of you were talking about the diets in your amazing programs and your books, which I've read all of them. You talk about the significance of nutrient density in what you're eating. Can you talk about maybe some of these foods that were really vital to you?
So you have to take some foods away, add some foods. It's much easier to start with the ads. So green leafy vegetables, for millions of years, that was the primary source for our carbohydrates, were green leafy vegetables. Then you'd have a few berries seasonally, and we eventually started eating roots, so we had a fair amount of dirt with all of that. When I modify this from the Paleolithic diet, I structured that you needed to have green leafy vegetables, lettuce, spinach, collards, kale, parsley, etc. The cabbage family, cabbage, onion, mushroom family vegetables. And then things that are deeply pigmented, like beets, carrots, berries. To help set the microbiome, more fermented vegetables, particularly the cabbage family, so sauerkraut and kimchi. And then to get more minerals into the diet, you want to have more seaweed. And also, if you have a liver once a week, heart, kidney, these organ meats, that would have been a traditional part of our diet. About a third of the meat that we have consumed would have been a combination of a variety of organ meats. So I wanted to get liver once a week, heart once a week. And by the way, heart is sort of like filet mignon. It's just so delicious. Liver can be so delicious if properly prepared.
Yeah, it's so interesting. I'm Iranian, and in our culture, they have a lot of liver, and so it's just, and it could be delicious if you make it. Yeah.
I'm going to ask you to send me some recipes, some traditional recipes. That would be so much fun.
It's funny. I don't eat it often, but after now you're saying the importance of it, I'm like, all right, maybe I'll listen to my mom and have some of it, but I'll send you some options.
Yeah, no. Liver once a week, super, super helpful. Now, my carnivore friends talk about a pound of liver every day. That is not good for you. Then you'll have overload of some of these nutrients, overload of the retinol. But 6 to 8 ounces a week, super good for you.
Yeah, and just going back to, you mentioned some kind of organ meat once a week, the leafy vegetables, the fermented foods. Is that something that you would recommend on a daily basis? Like, are those kind of the fundamentals that somebody should incorporate?
So absolutely on a daily basis. And when I first started teaching this, so at first I had these long lists of here are the foods I should be eating. Then when I changed my clinical practice, I had to teach it. And I didn't have much time with patients in the resident clinic. So now, even in my own clinic, for the traumatic brain injury clinic, I still only had 20 minutes. So I had to have my message in a bite-sized, memorable way for people to learn. And that's where I came up with 9 cups of vegetables, 3 cups of green leafy stuff, 3 cups of deeply colored stuff, and 3 cups of the sulfur-rich, the cabbage, onion, mushroom family vegetables. And then meat and 2 palm-sized servings of meat. And that would crowd out a lot of bad food. And when people were ready, then I talk about getting rid of the added sugars, getting rid of gluten, grain, getting rid of dairy. And what was fascinating was I was actually very effective at getting people with complex chronic diseases to try this. I'd say, you can decide when you want to start, how long you want the intervention to be. I'm going to suggest you do it for 3 months, but if that's too long for you, pick a time, at least 2 weeks, and what's the symptom you're trying to improve, and then see, did things improve or not. So in my clinical trials, I'd ask the students who were volunteering to follow the study diet for 2 weeks, just so they'd know what patients were having to do. And then, so my students would follow the diet, and my patients at the VA would follow the diet for 2 weeks, and then say, like, damn, that's too much work, I'm going to quit. And then at the end of 2 weeks, they'd finally gotten rid of the withdrawal symptoms, were feeling a little bit better, but they were so glad to get to go back to their pizza and beer. Then they would have non-compliant meals, standard American diet, and they felt like a truck hit them, because now all the inflammatory signals revved back up. They would have headaches, malaise, may have GI symptoms. They might have a flare of their asthma, a flare of the skin condition. And they realized, I guess I'm going to go back to eating that way, because I did feel a lot better. But they were in control. So my patients were remarkably compliant. So when they'd come back in 3 months, they're like, well, I'm eating that way, doc, and I do feel better. And we see that the blood pressures and blood sugars were better. My students that were volunteering in our lab, and these are young college students in the peak of their health, 20, 21 years old, they would come in and say, my mental clarity is much better. My energy is better. I'm doing better in my intramural basketball. And my attention is much better. I don't have as much ADHD. My ladies are saying, my periods are more manageable. And I had one young woman who said, my brother has schizophrenia. He's like waking up. It really was remarkable to see the impact, not only on my patients, but on our student volunteers who are healthy, realizing that no, they weren't healthy, that now they are healthy because they've improved their diet. And you can't not see that. So in the world, in the neurology world, I'm vilified, people are condemned, they're saying all these terrible things, and I just ignore it. I just do my thing, go speak where I'm invited, publish our papers, publish the next paper, publish the next paper. And so when I do these interviews and people would, condemn me, like, surely there was an error that you didn't have MS. Like, well, let's set that aside. We'll just talk about our prospective clinical trials where the diagnosis was confirmed by a MS specialist. We do our interventions, and we have consistent improvement. The critics like, well, so okay, so take me out of the equation. I think I'm irrelevant. I could be a source of hope, but take me out of the equation. Just look at our peer-reviewed published research. And now the other thing that I try to be much more explicit is, I'm not anti-drug. I'm anti-doing nothing. If taking DMTs may be exactly the right thing to do to prevent the relapses, to reduce the new enhancing lesions, you'll get much better outcomes if you also improve your diet, improve your exercise, improve your sleep, improve your stress. And then when you're doing great, you can have the same conversation I had with my neurologist. Says, I'm doing great. I'd like to transition either to a drug with fewer side effects, or if I can, without any DMTs. That's the sequence that I'm advocating. I'm not saying you come in, you have terrible disability, lots of lesions, don't take drugs, just do lifestyle. I'm saying, yeah, fine, take the drugs, but also do lifestyle. And then when you are doing great, then you can have the conversation like, can I transition to a drug with fewer side effects? And could I transition slowly, carefully off the DMTs?
You mentioned stress and lifestyle and other factors, and I've heard, and so many people have heard of, especially women being diagnosed with autoimmune condition after a particularly stressful period of life. I would love for you to talk about maybe some of those factors like sleep and stress that have a role in autoimmune disease.
Well, think of it as how many hits do you have? You have the genetic vulnerability. Like microbiome is probably also key. And then the more perturbations of your system, the more likely you're going to tip over to this autoimmune problem. So poor sleep, I will do that. Severe physical stress or psychological stress. In my clinical trials, when we do intakes, nearly always we can identify in the interview with the patient, in the previous 18 months, there was a severe psychological stress that the person identifies as potentially the trigger. And so that was the case for me. And another thing that's very, very common is adverse childhood experiences. I was not aware of this. And again, during all of the interviews for the intakes of patients for one of our clinical trials, we saw that all but one had severe adverse childhood experiences. And after that, it got me to reflecting on my life. And I realized when I was a young girl, age 9, my sister died. That was unexpected. It was profoundly painful for my family, and we had years of trauma after that. So I realized in retrospect that I too had some very serious ACEs. And that was probably a big factor adding to my autoimmune issues.
And I'm curious too, outside of stress, what are your thoughts about the role of sleep? Like, how important is that from your perspective?
Well, sleep is when one of the important functions of sleep is clearing of toxins out of the brain. We do that most effectively in deep sleep. And over the last 100 years, we've had about an hour and a half less sleep than we would have had 100 years earlier. So there's less cleaning of our brain, less restorative time while we sleep. We're making hormones, we're detoxifying. It's a very important part of our physiology, but we're all getting less of it. And I am an ambitious, hard-driving sort of person. I thought 4 hours of sleep was fine, and if I woke up early, I was like, that's fine. There's a lot of stuff I want to do. I'm A-okay with that. And I eventually realized, no, I am not A-okay with that. I need to make adjustments. And so I personally prioritize sleep much more so. And I do talk about the importance of sleep. But I also want to make clear that when I'm seeing my patients and we assess all these lifestyle factors, and I talk with them like, we can create a plan that addresses all of these factors, but you need to decide what you can implement and at what pace you can implement these changes. And for many of, in my clinics at the VA, we would start with a small, achievable next step. And I would ask them, in what domain do you want to start? Sleep, stress, exercise, connection, nutrition. So let's pick one domain, and I can sort of give you the big picture of what I'd like you to do. But the next action, I want to be small enough that you could do it.
I love that. So approachable. Because sometimes it could feel very overwhelming, but I love how you make it into bite size and you tackle one thing, then you go to the next, and it gives you the confidence that you're making progress. So I love that approach.
One small step, you succeed, then you can take the next small step and you can succeed. And it needs to be the domain that speaks to the person's heart. While I personally think food is the best place to start, for some, it was stress. For some, it was relationships. For some, it was exercise. And when I finally got to the point like, okay, here are the domains, which domain, and where are we going to start? And it may be that I have to lower my stress so that I could tackle diet, because I know that's going to be hard.
I think what you said kind of answers my next question. But for anybody who's listening who is maybe just newly diagnosed with an autoimmune disease, they don't really know what they're dealing with, but they're looking for a message of hope. And you said, you are a hopeful figure in this space, the most hopeful figure in this space. What would be something that you would kind of recommend to them or tell them?
So realize that in my clinical trials, in my clinics, we see people with significant disability make remarkable improvements. It will take a little work to address whatever domain that you want to work on. So a great technique is to think about, if my health could moderately improve, I'm not going to expect a full recovery, but moderately improve, what would I like to be doing that I can't do now? And maybe what I want to be doing is getting on the floor playing with my children or my grandchildren, or I'd like to be able to take my children to the water park, or I'd like to be able to walk my children to school. So there's a clear physical thing I'd like to be doing if my health could improve a little bit. Now I have a clear goal. And most of us will do really hard things for people that we love. It can be very helpful to think about, if your house was being to burn, so smoke rolling out of the windows, is there someone or something that you care so deeply about that you would run in to save without thinking? That's your children, your grandchildren, your spouse, might be your dog or your cat. And then once we identify who that is and what I'd like to be doing to be more effective with that person or your dog or your cat, now I have a reason to do some work. Now I have a reason to be more successful with, I'm going to work on improving my diet. I'm going to work on improving my exercise. I'm going to work on that domain, making improvements at a pace I can manage. And I've already mentioned that there are several different diets that are helpful. There are many different exercises that are helpful. More sleep, better sleep, that's going to be helpful. But having clarity on why you're doing this will make it easier for you to do things that require some effort.
Something really cool, I think, that you still offer, your team still offers, is that you guys have a database of people who are certified under the Wahls Protocol. Is that?
Yeah, so we train practitioners. So if you have practitioners who are listening, please come get trained. We'd love to train you. terrywahls.com/certification. If you are a member of the public, you can look for a certified Wahls practitioner to help you. And if you're a member of the public, people coming back to my website, sign up for email, because once a year we do a summit where I interview 40 experts and talk about all of these elements, what we can be doing to better manage our symptoms and quality of life. Because I want to empower people. I want the 25 million people with autoimmune disease or autoantibodies to know there are things that we can do to better manage our symptoms, potentially reverse the symptoms, reverse the disability, and have a richer and fuller life.
I love that.
We'll definitely include those details in our show notes too. But this was just so incredible, Dr. Terry Wahls. We're just so inspired by you and all the work you're doing. Thank you so much for spending this past hour with us. It was such a pleasure.
Well, much love to all of you. I'm going to put one more plug in. Everyone, follow me on my Instagram so you get to see what I'm eating and doing. Last winter, I went out for a roll in the snow after my sauna. So you get to see some fun videos, some food videos, a lot of encouraging.
Yes, we highly recommend it. We love following you. Just such an inspiration. And we'll include that also in our show notes if people want to check you out there. But thank you so much, Dr. Wahls. It was such a pleasure.
Thank you, Dr. Wahls.
Well, thank you.